Ladies and gentlemen, I'm Dr. Thomas TANNOU. I'm medical doctor geriatrician in Besançon, France, and I'm PhD student. It's my pleasure to present our works named Exploring Decision-Making Capacity of Alzheimer's Disease Patients using fMRI and interview, a proof of concept. I don't have anything to declare in link with this presentation. So how is decision-making in aging? We can see with literature that in behavioral analysis, aging is characterized by slowdown in the information processing speed and orientation towards conservative choices with less attraction to gains than to preventing loss. And the main time in neural analysis, and sorry, I see it's in French, data from literatures made with a meta-analysis shows the activation of prefrontal dorsolateral cortex, orbitofrontal cortex, and basal ganglia for decision-making. So can functional neuroimaging help the clinician to determine decision-making ability? This is a question we ask, saying that there is currently no specific test or score for decision-making ability to assess it in routine practice. Often just standardized genetics assessment and neuropsychological assessment, possibly with occupational therapists, it's enough. But sometimes, especially in case of legal issues, we need more. So we propose to use a risky decision-making behavioral task, the balloon analog risk task, adapted from functional MRI in younger patients, to see if brain areas known to be involved in decision-making in older adults are also involved in patients with questionable decision-making ability or not. So to verify that on healthy older adults, we try to propose a new protocol, this published in BMJ Open on the name of Imagision, to see if we can be able to activate the area expected from the literatures and to verify on older adults with Alzheimer's disease that the protocol is feasible and informative with patients with Alzheimer's disease. So we included 4 healthy subjects, average age of 80, and 2 patients for the cognition clinic of University Geriatric Center of Montreal in Canada with diagnostic of mild to moderate dementia. One is considered by his geriatrician as apt on decision-making, and the other one probably not. The healthy subject study confirms the expected activation of dorsolateral prefrontal cortex and orbitofrontal cortex and basal ganglia during the behavioral task. So you have here the fMRI activations. And about the 2 patients, we can see that for the clinically able patient, we objective a slower decision-making with conservative behavior consistent with geriatrician assessment of no risk-taking. Neuropsychological assessment is dominated by anosognosia, and fMRI show partial activation of expected areas. For the other one patient, we can objective impairment of executive function without compensation by slowing down in information process. Geriatrician assessment confirms the impaired decision-making ability to make complex decisions, but interviews show that patient can remain at home due to preservation of procedural memories. During BAT, we can see no increase in decision-making time and failure to learn strategies. No specific activation on fMRI, and qualitative interviews show the necessity of caregiver help and support for decision-making, but preservation of procedural abilities. So the future implication of our works is that our innovative protocol is feasible in a larger scale study, but we need to see fMRI as complementary tool rather than substitute for global evaluation, which is in fact discussion about decision-making capacity in Alzheimer's disease and neuroethics. So we need to see decision-making as an adaptive process with shared decision-making necessity. I can be reached at this email address in Montreal because I will leave there in a few moments. I want to thank you very much, everyone, for support.